Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana at Prather Chiropractic Services. Today we have a brand new patient, Mr. Arthur Rideau, that found us on our YouTube videos. He saw Dr. Johnson's videos, came across me, saw me adjusting Dr. Johnson working on me. He's like, in Lafayette, I'm from Opelousas, so I gotta go check that out. So Mr. Rideau has had some chiropractic care in the past and has had some success, right? I mean, it helped you in the past. He had a really bad slip and fall injury about 12 years ago where you had a broken jaw, whiplash injury. You've had headaches since then, neck pain, pain up and down his spine. He's got lower back pain, a compressed disc at L5, S1 that shoots pain down his right leg. That's called paresthesia, sciatica. You've had MRIs. You had a shoulder injury to the left. He's got some arthritis and degeneration and a partially torn rotator cuff in the shoulder. So he's banged up, okay? Lifting a lot of stuff over the course of your life, bumps and bruises, injuries, slips and falls. I mean, we all got it. Total mileage, gravity pulling us down, etc. So we did a thorough exam on Mr. Arthur's spine, did his x-rays, went through those with him, showed him everything I saw. And we talked a little bit about how chiropractic works, right?
Yes, sir.
The goal of what we want to do is improve the movement of your joints, okay? That's the goal of the adjustment. So we can help with the orthopedics and the neurology associated with that. We talked about that.
Yes, sir.
Made sense.
Yes, sir.
That's how we reduce the pain. Gave him some exercises, some stretches to do, etc. But this is going to be his very first adjustment with us here at Prather Chiropractic. So I'm excited for you to see what that's about. I think you're going to do well. You have any questions for me before we get started?
Yes, sir.
Okay, so you've seen our routine. We're going to do a full body adjustment. We're going to try to loosen up everything, get as many nerve endings and mechanoreceptors firing as we can in your body, and that just gives a nice global relaxing effect to help you with your pain, okay? All right, let's go. Now you start right here. We're going to go face down. Slide it down just a tad for him, buddy. There you go. Feel the midsection release. All right. So he's a little short on the right. Same thing we saw on the x-rays. Go ahead and bend your knees for him. And he gets long. And he's tight, very tight in the thigh muscles, the quads here. Okay, so we talked about stretching and the importance of stretching to support the adjustment and help with his range of motion. You feel any back pain with that?
Lord.
Yeah. Everything's just real tight and restricted. So, we're going to start mobilizing all these different segments. Gonna feel this pelvic piece kick up, Arthur? There you go. Starting the sacrum. Good. Zero in on that L5, okay? And that's where we saw that central disc protrusion on that MRI. Good. There we go. There we go. So far, so good, huh?
Yes, sir.
A little deeper than it looks on TV, huh? All right, so he did get longer on the right, and he's even at the bend. So give me a before and after. How's that back feel now?
Looser.
Yeah, good. So less pain when we bend the legs, right?
Yes, sir.
Okay. All right, gonna feel this headpiece kick up? Okay, Arthur, go ahead and roll over for me, buddy. Flat on your back. Okay, good. Just take your hands and rest them on your chest right here. There you go. Feel the headpiece kick up. Now that helps bring that head back over those shoulders, like you saw that head forward posture we had in the X-ray. Helps bring that head back. Okay, let's take your arms, put them in a T, stretch them out nice and wide. Feel the chest piece kick up. Tighten that up a little bit. Now we're going to mobilize your shoulders, sternoclavicular joints, sternocostal joints. Okay, hands on the stomach. There we go. Now dangle the leg for me. Decompress that hip. Good one. Good one, good one. Now this is what we saw in the X-ray too. That left hip has a little arthritis in it. Okay, a little decreased joint space. So we're gonna put some space in that. Okay, dangle the leg. There we go. Good one. All right, I'm gonna sit you up, sir. Spin you to the right. Now, let's see if we can knock some rust off these shoulders, huh? Good range of motion on the right one. I know it's your left one that's a little. Boy, you hear that breaking up in there? We were explaining to Arthur that, you know, the body goes through, immune system responds to a joint injury or a tissue injury, 3 phases. First phase is inflammation. And if that stays there long enough, then the body starts to make scar tissue in that area. Felt that break up? That's breaking up that calcification in there. Then after scar tissue is the calcification. And that's rust. We just think of it as rust. And by adjusting the joint correctly and appropriately, we can help restore some of that range of motion that gets lost through that inflammation, scar tissue, calcification process. Obviously, you don't want to do that too rough and cause more damage. But that's the art. The art of chiropractic is adjusting your pressure and adjusting your torque and your force and whatnot to match and marry with the patient's injury and their body type. All right, how's that feel so far?
Good.
Good, huh?
Good.
All right, man. Ring dinger time. Got to decompress that L5-S1, okay? I'm gonna have you sit here, Arthur, and lay back this way. There we go. Rest your hands on your tummy, just like that. All right, slide it down just a little bit there. Okay, sir, we're gonna lift the legs, so just keep your legs nice and relaxed here. Oh, it felt you move. Real sensitive safety mechanism in there that'll cut off. Let's go and lift your legs for me a little bit. Cut the table off if it senses a shift. All righty, sir. Go ahead and let them relax. All right. Now you've seen these pins here. You know what these do? Keeps you from sliding, right? Squeeze you tight. What you had for breakfast?
What, sausage biscuit?
Oh yeah, we're about to get, he's about to get squeezed. All right, tight squeeze, bro. Let it sink. Just breathe in and out through the nose. There you go, my man. All right, you in there good and tight?
Yes, sir.
Okay, what I want you to do for this, as you've seen on the videos, keep your teeth touching, tongue in the center of your palate so you don't bite it. Breathe in and out through your nose. Wiggle your third toe. Oh, that was a good one. That was a good one. You ever felt anything like that?
No, sir.
What did you feel?
I felt it release from the top of my neck all the way down to the pelvis.
That's what we wanted. That's what we wanted. Yeah, still kicking. See, that's a direction of force that's never been put through your spine, you know? That compressive stress we saw at L5-S1, where those nerves don't have a lot of room. we're opening that up. We're opening that space up. So. All right, let's work that neck a little bit more. C6, C7 there. Okay, good. Decent movement. Same thing here. There we go. All right. Ring dinger done.
Mm-hmm.
All right, I'm going to sit you up now, Mark. Do you want to get up or you just want to stay here all day?
No, I'll get up.
Okay, come on. All right, walk that around for me, buddy. Welcome to Team Ring Dinger, man. How you like that?
Total different.
Total
I
different,
feel a
huh?
total release on my back.
That's cool.
It's not like I'm all jammed tight.
Yeah.
I'm like
You're taller. You're already a tall guy. Yeah, you got an inch taller already. But that's what happens. The neurology and the orthopedics behind the adjustment, it does get a little bit complicated. But when you get these mechanisms firing properly, the shoulders get brought back over the pelvis. The head gets brought back. Your body is working against gravity like it should now, or at least greatly improved.
I feel a big difference.
Okay,
A
well,
big
good deal.
difference.
Usually, if you're sore from the adjustment, for 72 hours, you can use ice, nothing fancy, Ziploc bag, freezer bag, put some crushed ice in it. You can apply it here, apply it to the low back. And what we typically see is our patients will experience 75, 80% improvement in their symptoms within 3 or 4 adjustments. It's that quick. There's no long-standing 30 visit, 40 visit treatment plans where I'm seeing you 3 times a week for 3 months. That doesn't happen. We don't need to do that.
Okay.
When we do an adjustment this thorough, we get results quickly. And then you can go about your daily life and get a tune-up whenever you need to. Okay. But that's the goal. So you have any questions for me?
No, sir. I appreciate
All right.
what you did.
All right. I
Thank you,
appreciate
sir.
you. All right. If you like the material, please subscribe to the channel, share with your family and friends, get the word out about what chiropractic can do. We're drug-free here. We're not pushing surgery. We're not trying to push injections. We're trying to work with the body's own capacity to heal. Chiropractic's a very powerful thing. It's a very safe thing. This is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.